mind you, this organization prides itself on family orientation, and we care about you as an employee, we care about you, again, as a family member, but I will say that my experience in this organization was anything but, and sadly I'm not the only person to have experienced this, but I'm probably the first to bring it forward. Within all due respect to this organization, this opportunity that we're having today to share these stories, I hope continues the momentum for other folks, because we join healthcare for the greater good. And when you're broken down at the individual level like this is going to continue to happen and fester, and we need to change the narrative for the next generation, or we won't have doctors and nurses to take care of us. You go to school to be a nurse and you think as a nurse there's nothing else better than bedside nursing in a hospital. That is just kind of the expectation and the secret message, if you will, to get your clinical experience. And I will say hospitals have become my second home. You know, I spent many Christmases and Thanksgivings and other significant holidays in a hospital, and they become family, those folks around you. And I think the tipping point for me was the verbal, mental, and emotional abuse from various leaders that I was directly reporting to. At the time, I was running several specialty clinics and working 16 hours a day, 7 days a week, trying to stay afloat. The position I was given was meant for 2 directors, but given budget constraints and all the things, the decision was to give more to the leaders and, provide, less for our patients and for our physicians. And not only was I had the constant fear of not being enough, not doing enough, not giving enough, but my leader was verbally abusive to me. Within a month of starting that job, I got very, very sick and was bedridden for about a week. And this leader called me, who is also a nurse, called me and yelled at me for getting sick, blamed my children for exposing me to this illness, and that I must, going forward, mask and isolate myself from my children because I don't have the time to get sick. And my inconveniences, my absence then become my direct supervisor's absences and chaos. And these are verbatim the words that were spoken to me. I was expected to continue to get my spreadsheets and budget work done by the end of that week. Again, I was bedridden and very ill, and I was also expected to sober during that week, and that started this very busy career path and went downhill ever since. We had volatile physicians who, rightfully so, had been lied to continuously year over year. They lost pay year over year, and it was really that mentality of shut up and do your work and do more with less. That was a common thing to hear. And the physicians that I worked with, I had a great relationship with them. I charge by honesty, and I believe leading with integrity just helps open the door for collaboration. And that wasn't the mentality of my superiors. And so, we'd have department meetings, and my physicians were just blatantly upset and were threatening various legal actions which in turn I got blamed for, assuming that I'm siding with the physician groups and not siding with administration because I was, adding as a voice of reason for their frustration. But they also understood that I was powerless, so to speak, in making any of the changes that they requested. And some of the changes that they were requesting, in my opinion, were not financially detrimental to the organization. And honestly, simple fixes that would cause, really easy wins for them and for the patients. And so it was the constant abuse, it was the constant fear factor, and really you must not have what it takes to be an administrator mentality for me to almost believe those words. And unfortunately, it's that abuse, that same form of abuse, mental, emotional, that distressing feeling has occurred in other leadership positions in other organizations that I've experienced. And you start to think that you are the problem, and then you start to say, gosh, do I even want to stay in healthcare? But I can't imagine doing anything else because that's what I'm called to do. And so when your entire life story, you question if you wrote the wrong book or picked the wrong publisher, you really start to self-reflect and self-doubt. And that doesn't go away. That doesn't go away in 6 months. That doesn't go away in 6 years. It is something that sticks with you forever. And certainly that trauma is certainly triggered by the next organization. Leaving those positions to take care of me was the hardest thing to do because I felt like I was leaving behind a family to flounder. And, some of my most challenging and difficult staff and some of my most challenging and difficult providers were in tears when I submitted my resignation because they knew and they were appreciative that I wouldn't stand for that type of behavior. The downside of that is the label now on me, and that quickly spreads, and, my future chances of going back to this organization, even if I wanted to, would be unlikely, especially in a leadership position. I care for the people that are doing the work, I care for the people, the providers, all of it, quite honestly, and I wouldn't want anyone to go through what I have gone through, and as of late, I left the position and took some time off to heal, to recalibrate, someone told me, and that was spot on. I've never in my life not had a plan B, and for once, I decided I had enough, and never had a plan B, but my plan B was to heal. And for anyone out there that thinks that they can't take time off to heal, I would challenge that because those 4 weeks were very healing. I was able to find myself, rebuild my confidence, just build my strength again as a human, as a nurse, as a leader, and as a mom. And I am more present in those actions because I took the time to heal. My last position, despite all the things that I've gone through, was probably the worst position I've had in my life. My supervisor very early on identified that he was not in my court and actually contributed to situations where other folks are trying to get me fired by accusing me of some pretty unlawful things that I couldn't even imagine doing or even thinking of. But it was that subsequent sequence of events of constant fear of getting written up for something. And so I was making sure I put in at least my 40-hour work week. I made sure that I had checked every box. I had crossed every T and dotted I, and maybe looked at it 3 times over for constant fear of getting fired. And my one-on-ones became abusive as well. It was constant negativity, this person doesn't like how you said something, that person thinks you're not doing this, and instead of advocating for me or validating, he didn't. And he would, I prefer direct feedback, and it become almost a mobbing situation that the leaders of this organization all believed these things that were being said, and therefore I knew that I had to make a decision for me and leave. I was in an advisory role. The team didn't directly report to me. They reported through clinical executive directors, which, no model of structure is ever perfect, right? But it's the people that make that work. And, with my, really innate behavior of quality, I focus a lot on, our rules and regulations in healthcare. There's a lot of them, and they're complicated, but it's so important because that carries over into, that patient at the bedside. And raising concerns of compliance was also to my detriment. And, but in the same token, I was being blamed for the things that were being done. Mind you, the things that I was being blamed for, I hadn't even worked for that organization yet, and it was a continuation of what I call the blame game, finger pointing, no accountability, no responsibility, and the overall general lack of accountability became my problem, and it was too much. It was way too much. And I know I'm not alone in that, but I also know that there's people that have it and have had it worse than me, where some of that abuse can even become sexual. And regardless of the abuse type, it makes you not want to be in healthcare again. But you really should be asking the people, and the people that are doing the work, because they can tell you if we're modeling that behavior. Even the self-reflection of leaving healthcare, at the core of who I am, I can't do it. And I will find a way to be a nurse forever, but also, not accepting what is sadly kind of becoming a norm in the healthcare arena. The position I recently left, my supervisor had the audacity to tell me, you should really think about what you want to do and look for that opportunity. And I was taken back by that because I was in my element. I loved the work that I did, and it had taken me several years to get to that position, right? And for someone who had never supported me to give me that advice, I laughed it off. I have checked this person out of my life. That chapter's closed. I'm healed, but the scars are there. And my current company is outstanding. There's no personal attacks. We build upon each other's strengths. And I think being part of an organization where you wouldn't think is clinical, but I get to use my clinical expertise, my decades of nursing and healthcare experience, even in the governance of healthcare, it's priceless. And I'm fortunate enough that this opportunity came up within my community, but sometimes that doesn't always happen. I had friends and other nurse leaders and other leaders at different places that I had met throughout my career. Yeah, that welcomed my tenacity, that welcomed my disruptive attitude, that welcomed I wear my heart on my sleeve, but I'll be the first to bring forward a concern because it's positively intended. And so it was constant reinforcement, hearing other people's stories almost was a validation of, okay, I'm not alone, I'm not in this alone, and this is a bigger problem than what, I'm experiencing. And I think just constantly talking to those folks to either empower you and continue to fight or get out and find something that fits. And those are hard pills to swallow. We all expected our lives to go a different way. And I think not overthinking things is also a benefit to moving on. Something I would have ever considered, but it has given me the opportunity to find this position. No plan Bs, just not accepting. these environments. I don't get very many exit interviews when I leave positions because they already know, and they don't want to hear it. And so I just have to laugh because those that really know within the organization know that, it wasn't a me problem. And at some point you have to be okay with that too and close the chapter. And even if it's been 20 years, those wounds tend to fester. As I was looking for the next opportunity, I certainly applied for some jobs to help pay bills. And every time I interviewed with some great people, I had that nauseous feeling of going back to the abuse, all of it just resurfaced. And I'm sure I didn't interview well because I, in the gut of who I was, didn't want the job. I just couldn't put myself and my family back in that position. And then you almost start over. And this opportunity that I'm in is a blessing in disguise. Perhaps, that broken road is what led me here. But it doesn't have to be. We know healthcare is expensive, but it's at the expense of the people, not the institution. And I don't know that everyone recognizes the real healthcare crisis. And I would just say to anyone who wants to give up or get out, find it within you what brings you joy and brings you value.